Hi, my name is Felix the cat flea, Ctenocephalides felis to be exact. But despite my name, I don't just stick to cats, and I'm an opportunist when it comes to feeding on any mammal I find. I'm a proud member of the Siphonophora family. Identify me based on my lack of wings, laterally compressed body, genal and pronatal combs, piercing mouthparts, and spines. Us cat fleas are pretty tough, and you can find us almost anywhere in the environment. My holometabolous life cycle means complete metamorphosis. After hatching, I grew through 3 larval stages and fed on blood-rich flea feces. In my pupa phase, my cozy cocoon protected me from harsh conditions so that I could endure for months without a host. Once I emerged, I could only be a free-living adult for so long until hunger set in and I had to seek out a tasty blood meal.
These fleas are everywhere. Following the domestication of cats, they're found on all continents except Antarctica, especially coastally in Australia. I likely got my infection from the environment, showing localized erythema, pruritus, alopecia, crusting, and pustules. The vet says I developed flea allergy dermatitis caused by the antigens within flea saliva, which caused a hypersensitivity response that is making me itch like crazy. The vet also said if I was any smaller, I'd be at risk of developing anemia with how severe my infestation was. This is particularly a concern in smaller animals with a lower blood volume or immunocompromised individuals. Luckily for me, I haven't shown any signs of infections by pathogens commonly carried by fleas. For instance, they can give cats flea tapeworm, calicivirus, and even FELV. Some immunocompromised felines can also develop disease from Bartonella, while some canines can show mild clinical signs when infected with rickettsia.
I also have a bad case of itching, but luckily, there are several ways to diagnose a flea infestation. The best way is to confirm the physical presence of fleas on my coat. Alternatively, wet blotting paper can be dabbed onto the skin and a red stain suggests flea dirt or flea poop with hemoglobin content. Microscopic exam can also be used to identify fleas in material brushed from my coat. Otherwise, clinical signs, including alopecia and secondary bacterial infections, can assist with diagnosis in the case of flea allergy dermatitis. It's also a good idea to check the home environment for fleas, which my owner easily did by walking around the house in white socks to check for obvious black dots. But how do we get rid of fleas once they've taken hold? The first step is to treat the host, aka me and my feline friend. This usually involves oral or spot-on flea preventatives, which have an adulticide action. For pets with flea allergy dermatitis, systemic glucocorticoids may be needed to relieve pruritus. The next step is to treat the environment to remove the flea reservoir, limiting the possibility of reinfestation. The most simple way to do this would be to just burn the house down and move to Antarctica. But seriously, controlling fleas in the environment includes cleaning carpets, furniture, and washing all bedding. Juvenile hormone mimetics or insect growth regulators can also be used to chemically disrupt the flea life cycle. Similarly, pyrethroid insecticides can be applied, but be careful as these are highly toxic to us animals and some fleas have developed resistance to them.
Fleas may be small, but in large enough numbers we can create big problems. So, do yourselves a favor and keep your environment clean and treat your pets with regular preventatives. But even with all that, you can never truly be free of the cat flea.